Welcome back to the channel. Today we're diving into an important topic, modafinil and its effects on depression. As you know, millions of people around the world struggle with this condition, and finding effective treatments is crucial. Modafinil is a medication typically used to treat sleep disorders, but there's growing interest in its potential for managing depression. Before you consider this or any treatment option, it's essential to understand the facts. In this video, we'll unpack 6 crucial facts about modafinil and its impact on depression, exploring its uses, potential benefits, and drawbacks. Let's get started. Okay, so first things first, let's talk about what modafinil is actually prescribed for. Modafinil is a wakefulness-promoting agent primarily used to treat sleep disorders like narcolepsy. You know, that condition that causes excessive daytime sleepiness. It's also used for obstructive sleep apnea, where your breathing repeatedly stops and starts during sleep. Now, while modafinil isn't FDA approved specifically for treating depression, doctors can prescribe it off-label for this purpose. Off-label prescribing is totally legal and often done when there's scientific evidence to support the use of a drug for a condition other than what it's officially approved for. It's important to remember that just because modafinil can be prescribed off-label for depression, it doesn't mean it's the right choice for everyone. That's why we're going to dive into more specifics about how it works and what the research says. We'll get into that right after this quick message. Welcome back. Now let's talk about how modafinil actually works in the brain. It's not like a magic pill that instantly makes you happy, unfortunately. Modafinil is thought to work by increasing the levels of certain neurotransmitters in your brain. Neurotransmitters are like chemical messengers that carry signals between nerve cells. One of the key neurotransmitters modafinil affects is dopamine, often called the feel-good chemical. Dopamine plays a role in motivation, reward, and pleasure, and low levels of dopamine are associated with depression. Modafinil also affects other neurotransmitters like norepinephrine and histamine, which are involved in wakefulness, alertness, and cognitive function. By influencing these neurotransmitters, modafinil can help improve focus, energy levels, and overall mood. But remember, everyone's brain chemistry is unique, so modafinil's effects can vary from person to person. What works wonders for one person might not have the same effect on another. It's all about finding what works best for you, and we'll talk more about that later. Let's get into some of the research that's been done on modafinil and depression. Now, the research in this area is still ongoing, but some studies have shown promising results. For example, a study published in the Journal of Clinical Psychiatry found that modafinil, when added to standard antidepressant treatment, was more effective in improving depressive symptoms than a placebo. Another study in the journal European Neuropsychopharmacology found that modafinil improved mood, fatigue, and cognitive function in patients with major depressive disorder. So there's definitely some evidence suggesting that modafinil could be a helpful tool in managing depression. However, it's super important to understand that these studies don't tell the whole story. More research is needed to determine the long-term effects of modafinil on depression and to identify any potential risks. Chapter 4: Potential side effects of modafinil. Like any medication, modafinil can have side effects. It's important to be aware of these potential side effects before considering taking it. Some common side effects include headaches, nausea, anxiety, insomnia, and dizziness. Now, for most people, these side effects are mild and tend to go away on their own after a few days or weeks. However, in some cases, more serious side effects can occur, such as allergic reactions, skin rashes, or even changes in heart rhythm. It's crucial to listen to your body and talk to your doctor if you experience any unusual or persistent side effects while taking modafinil. Remember, your health is the top priority, so don't hesitate to reach out to a healthcare professional if you have any concerns. Chapter 5, Modafinil versus traditional antidepressants, a quick comparison. So how does modafinil stack up against traditional antidepressants? Well, traditional antidepressants like SSRIs or SNRIs work by increasing the levels of serotonin and norepinephrine in the brain. These neurotransmitters play a crucial role in regulating mood, sleep, and appetite. While both modafinil and traditional antidepressants can be effective in treating depression, they work in different ways and have different side effect profiles. Modafinil tends to have a faster onset of action than traditional antidepressants, meaning you might experience its effects more quickly. However, traditional antidepressants have been studied more extensively for depression, and there's more long-term data available on their safety and efficacy. It's really about weighing the pros and cons and discussing your options with your doctor to see what's best for your individual situation. Chapter 6. The importance of consulting a healthcare professional. All right, folks, we've covered a lot of ground today about modafinil and its potential role in managing depression. But before you jump to any conclusions or make any decisions about your treatment plan, there's one crucial thing I want to emphasize. Talk to your doctor. Remember, I'm not your doctor. I'm just a doctor on YouTube. I can't provide personalized medical advice, and neither can any video or article online. Every individual is different, and what works for one person might not work for another. Your doctor knows your medical history, any other medications you're taking, and can assess whether modafinil is the right treatment option for you. They can also help you weigh the potential benefits and risks and guide you towards the safest and most effective course of action. Outro, stay informed, stay healthy. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more informative content. Remember, knowledge is power when it comes to your health. If you're struggling with depression or any other health concern, don't hesitate to reach out to a healthcare professional. They're there to provide support and guidance on your journey to better well-being. Stay healthy and see you next time.